Let's talk about the treatment principles, the root and manifestation. After making a diagnosis and identifying the patterns, the next logical step is that of determining the principle of treatment to be adopted. The practitioner of Chinese medicine will need to formulate a rational and coherent plan of action as to what should be treated first, what is primary and what is secondary in the patient's condition, what is the relative importance of the acute or chronic condition, and what method of treatment should be used. Over the centuries, Chinese medical theory has answered these questions and provided a coherent system of principles of treatment. In practice, these principles provide a logical framework according to which a practitioner can evaluate the objectives of his or her treatment. A principle of treatment should always be established before treatment commences. This is achieved by a rigorous analysis of the clinical manifestations and a synthesis of the patient's condition and therapeutic needs at that particular time. The principles of treatment do not necessarily follow logically from the identification of the relevant pattern of disharmony, except in a few simple conditions. Most of the conditions we see in practice are characterized by multiple patterns and a coexistence of deficiency and excess. Thus, although our diagnosis of the patterns involved may be absolutely correct, the success of the treatment depends very much on the adoption of the correct strategy and method of treatment. For example, although we may correctly diagnose spleen deficiency and dampness, should we concentrate on tonifying the former or eliminating the latter, or should we do both simultaneously? The adoption of the correct treatment principle in deciding whether to tonify the body's qi or eliminate pathogenic factors is absolutely crucial to the success of the treatment. The adoption of the correct treatment principle in deciding whether to tonify the body's qi or to eliminate pathogenic factors is absolutely crucial. Thus, the therapeutic encounter starts with diagnosis, using the tools of observation, interrogation, palpation, and hearing or smelling. Using these tools, we identify the patterns of disharmony. After that, we need to identify and evaluate carefully the root and manifestation, distinguishing between fullness and emptiness. It is only after doing this that we can formulate a suitable treatment strategy and method. Two main meanings of root and manifestation. The root is the root of the condition, for example, wind cold, and the manifestation is the clinical manifestations, like aversion to cold, fever, floating pulse. The root of the condition is the original pattern, for example, spleen qi deficiency, and the manifestation is the deriving pattern, for example, dampness. So the tools of diagnosis are the four pillars: observation, interrogation, palpation, hearing, smelling. Then we identify the patterns. Is it pattern A, B, or C? Then we identify the root and manifestation, and to identify whether it is full or empty. Then we come up with a treatment principle. A few examples will clarify this. A patient with chronic bronchitis presents with an acute attack of wind cold or wind heat. A common cold or influenza, for example. Should we treat the acute attack first and ignore the chronic condition? Or should we treat both at the same time? A patient with deficiency of qi causing great tiredness also has symptoms of dampness and a thick, sticky tongue coating. Should we concentrate on tonifying qi or on eliminating dampness, or on doing both simultaneously? A patient has been having a recurrent temperature and flu-like symptoms for weeks. She is completely exhausted, but her pulse is full and wiry. Should we tonify her body's qi or expel the exterior pathogenic factor still lingering in the interior? An old man has deficiency of yin with rising of liver yang causing hypertension. We need to reduce liver yang, But as the patient is old and frail, will reducing liver yang weaken his energy? An elderly patient suffers from a kidney deficiency, but also from pronounced blood stasis, phlegm, and heat. Should we concentrate on tonifying the kidneys or on invigorating blood, clearing heat, and resolving phlegm? Or should we do both simultaneously? If we choose to invigorate blood, resolve phlegm, and clear heat, would that weaken this elderly person? These are a few examples of complex situations encountered in clinical practice every day, requiring a clear differentiation between what is primary and what is secondary, an assessment of the patient's condition, and a clear principle of treatment and plan of action. Thank you for your attention.